Welcome to our channel. Have you ever wondered what the real impact of daily masturbation is on your prostate health after the age of 60? This is an issue that many mature men face in silence, with questions that are rarely discussed openly, even with healthcare professionals. Today, we're going to break this taboo and reveal surprising information that could completely change your understanding of this sensitive subject. The relationship between masturbation and prostate health has been the subject of many myths and misconceptions over the years. Some say that frequent practice can be harmful, while others claim that it has benefits. But what really happens to your body, specifically your prostate, when you maintain the habit of daily masturbation after age 60? The answer may surprise you and possibly completely change your habits and quality of life in the coming years. Keep watching, as we will reveal crucial information based on recent scientific research that every mature man should know. You deserve to understand what really happens to your body and how you can make informed decisions to protect your health and maintain your vitality even after the age of 60. First of all, it is important to understand what the prostate is and what its function is in the male body. The prostate is a gland about the size of a walnut, located just below the bladder and surrounding the urethra, the tube that carries urine and semen out of the body. It plays a key role in male reproductive health by producing part of the seminal fluid that nourishes and protects sperm. With advancing age, especially after age 60, the prostate naturally enlarges in many men, a condition known as benign prostatic hyperplasia. This growth can put pressure on the urethra and cause a number of uncomfortable urinary symptoms, such as difficulty starting the flow, feeling of incomplete bladder emptying, frequent need to urinate, especially at night, and weak or interrupted urinary flow. In addition, the prostate also becomes more susceptible to inflammation, infection, and, in more serious cases, the development of cancer, which is one of the most common forms of cancer among men over the age of 60. Now, you may be wondering, what is the relationship between masturbation and all these possible prostate problems? Can frequent masturbation aggravate these problems or, on the contrary, offer some kind of protection? This is precisely the question we will address below, based on scientific evidence and not on personal opinions or popular myths. Are you ready to find out what science really says about this? Scientific research has investigated the relationship between frequent ejaculation, whether through sexual intercourse or masturbation, and prostate health. Some important studies have revealed interesting findings that every mature man should know. Long-term observational studies have followed thousands of men for decades and found correlations between ejaculation frequency and the risk of developing prostate problems. One of the most significant findings was that men who ejaculated more frequently, about 21 times or more per month, had a notable reduction in the risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. This protective effect seemed to be particularly relevant for men over the age of 60. But how does this work? Researchers believe that regular ejaculation may help eliminate potentially harmful substances that accumulate in the prostate over time. When you ejaculate, the prostate contracts to help expel seminal fluid. This process acts as a kind of natural cleansing of the system, eliminating old cells, microscopic calcium crystals, and other substances that, if accumulated, could contribute to inflammation or even the development of cancer cells. Think of your prostate as a water pipe that needs to be cleaned regularly to prevent blockages. If water does not flow frequently, residues can accumulate on the walls and eventually cause blockages. Similarly, regular ejaculation allows prostatic fluids to be renewed, keeping the system cleaner and healthier. Are you enjoying the information? This is just the beginning of what we have to share with you today. If you are concerned about your prostate health or know someone who could benefit from this information, please like this video and share it with those who need it. Your support helps us bring this important information to more men who may be suffering in silence. Do you identify with the symptoms we mentioned? Are you experiencing urinary difficulties or concerned about your prostate health? Leave the phrase, "I want to take care of my prostate," in the comments so we can understand how many of you are facing these challenges. Your participation not only helps us create more relevant content, but it can also motivate other men to take better care of their health. Now, let's continue with our analysis. Despite evidence suggesting the benefits of frequent ejaculation for prostate health, it is important to understand that there is a balance to be considered, especially for men over 60. Daily masturbation, in itself, is not necessarily harmful to the prostate. In fact, as we mentioned, it can offer protective effects. However, there are important aspects that need to be considered when talking about daily practice after age 60. First, we need to understand that the male body undergoes natural changes with aging. Testosterone levels gradually decrease, which can affect sexual desire, the ability to obtain and maintain erections, and the ejaculation process itself. Some men may experience discomfort or even pain during ejaculation if they have conditions such as prostatitis, inflammation of the prostate, or prostate stones. In these cases, frequent masturbation could potentially aggravate symptoms rather than relieve them. It is crucial to be attentive to the signals your body sends you. If you notice any discomfort, pain, blood in your urine or semen, or significant changes in urinary function after masturbation, this may be an indication that something is not right, and it would be advisable to consult a healthcare professional. Another important aspect to consider is quality versus quantity. The health benefits for the prostate seem to be more related to the regularity of ejaculation than necessarily to daily frequency. For many men over the age of 60, a frequency of 2 to 3 times a week can offer similar benefits without causing unnecessary stress to the body. Compulsive masturbation can also be a sign of underlying emotional or psychological problems, such as anxiety, depression, or ways of coping with stress. If you feel that you have no control over the habit, or if it is interfering with your daily life, relationships, or emotional well-being, it would be advisable to seek professional help. In addition, it is important to remember that prostate health does not depend solely on the frequency of ejaculation. Other factors play equally or even more important roles, such as a balanced diet, regular physical activity, weight control, avoiding smoking and excessive alcohol consumption, and regular medical checkups, including specific prostate exams. Let's now address some common myths about masturbation and prostate health that many men still believe. One persistent myth is that frequent masturbation can cause erectile dysfunction. In fact, there is no scientific evidence to support this belief. Erectile dysfunction is usually related to factors such as cardiovascular disease, diabetes, low testosterone levels, use of certain medications, stress, anxiety, or depression. Another myth is that excessive masturbation can deplete the body of essential nutrients. Although semen contains proteins, vitamins, and minerals, the amount lost in each ejaculation is minimal and easily replenished by a normal, healthy diet. There is also a mistaken belief that frequent masturbation leads to prostate growth. As we mentioned earlier, prostate growth, benign prostatic hyperplasia, is a natural condition related to aging and hormonal changes, not the frequency of ejaculation. In fact, as we discussed, regular ejaculation can have beneficial effects on prostate health. A fourth myth is that sexual abstinence increases vitality and energy. This belief has no scientific basis. On the contrary, healthy sexual expression, including masturbation, is associated with lower stress levels, better sleep, and a general sense of well-being. Finally, there is the myth that older men should not masturbate or engage in sexual activity. This idea is not only incorrect but potentially harmful. Sexuality is a natural and important part of human life at all ages, and its healthy expression can contribute to physical and emotional well-being, regardless of age. Now that we have clarified some of the most common myths, let's focus on balanced and healthy approaches to masturbation and prostate health after age 60. As we mentioned, regular masturbation can offer benefits for prostate health, but it is important to find a balance that works for you, considering your overall health, level of sexual desire, and personal comfort. For many men, a moderate frequency of 2 to 3 times a week may be beneficial, but this can vary significantly from person to person. The most important thing is to listen to your body and respect its natural limits. If you are concerned about your prostate health, there are several natural approaches that can complement a healthy sex life. A diet rich in fruits, vegetables, whole grains, and lean proteins, and low in saturated fats, red meat, and whole dairy products can help reduce the risk of prostate problems. Particularly beneficial foods include tomatoes, rich in lycopene, pumpkin seeds, rich in zinc, nuts and seeds, sources of essential fatty acids, cold water fish, rich in omega-3, and cruciferous vegetables such as broccoli and cauliflower. Regular physical activity also plays a crucial role in prostate health. Moderate exercise such as walking, swimming, cycling, or yoga can help improve blood circulation in the pelvic region, reduce inflammation, and improve overall health. Try to incorporate at least 30 minutes of physical activity on most days of the week. Stress management is another important aspect. High levels of chronic stress can negatively affect prostate health and sexual function. Techniques such as meditation, deep breathing, yoga, or relaxing hobbies can help reduce stress and improve overall well-being. Maintaining a healthy weight is also essential. Obesity is associated with an increased risk of prostate problems, including cancer. Combining a healthy diet with regular physical activity can help maintain a healthy weight. In addition, it is crucial to have regular medical checkups, including specific prostate exams such as a digital rectal exam and a PSA, prostate-specific antigen, blood test. These tests can help detect problems in their early stages, when they are more easily treatable. If you are experiencing problems such as urinary difficulties, pain during ejaculation, or other prostate-related concerns, do not hesitate to consult a healthcare professional. Many men avoid seeking help due to embarrassment, but it is important to remember that these are common medical problems that professionals are accustomed to treating with respect and confidentiality. There are also some natural supplements that have been studied for their potential benefits to prostate health. These include saw palmetto, Sereno repens, which may help reduce the symptoms of an enlarged prostate, Pygeum africanum, which may decrease inflammation, zinc, important for healthy prostate function, vitamin D, low levels of which have been associated with an increased risk of prostate problems, and selenium, a mineral with antioxidant properties that may protect prostate cells. However, it is important to consult a healthcare professional before starting any supplementation, as these products may interact with medications or not be suitable for everyone. In addition to physical approaches, we cannot ignore the psychological and emotional aspects of male sexuality, especially after age 60. Many men face emotional challenges related to changes in their bodies and sexual performance as they age. It is important to recognize that these changes are natural and do not diminish their value or masculinity. Cultivating a positive self-image and a realistic attitude toward aging can significantly help maintain a healthy and satisfying sex life. Open communication with partners is also essential. Many couples find new forms of intimacy and sexual satisfaction as they age, adapting to the natural changes in their bodies and desires. Remember that we are not alone on this journey. We all age and face similar challenges. Sharing experiences and seeking support when needed, whether from partners, trusted friends, or professionals, can make a big difference in how we experience this stage of life. Now, if you've been watching this video up to this point, it means you really care about your health and well-being. We would like to thank you for your attention and dedication in seeking reliable information on this important but often neglected topic. If you haven't subscribed to our channel yet, now is the perfect time to do so. By subscribing, you will regularly receive valuable content like this, covering various aspects of men's health after age 60. Our goal is to provide evidence-based information that can help you live a healthier, more vital, and more satisfying life at this important stage of life. In addition, by subscribing and activating notifications, you will be one of the first to know when we release new videos addressing other crucial topics for men's health and well-being, such as natural strategies to increase testosterone, ways to improve erectile function without medication, techniques to improve sleep and energy, and much more. Your support motivates us to continue producing quality content and expanding our community of men committed to improving their health and quality of life. Now, let's return to our main topic and explore some more important aspects of masturbation and prostate health after age 60. One aspect we haven't covered yet is how masturbation can be part of an overall prostate health routine. Just as we exercise to strengthen our heart or muscles, there are specific exercises that can benefit the pelvic region and prostate. Kegel exercises, which involve contracting and relaxing the pelvic floor muscles, can help strengthen this area, improving urinary control and potentially sexual function. You can identify these muscles by trying to interrupt the flow of urine during urination. The muscles you use to do this are the same ones you will work on in Kegel exercises. To perform these exercises, contract these muscles, hold a contraction for about 3 seconds, and then relax for 3 seconds. Repeat this process 10 to 15 times, 3 times a day. Over time, you can increase the duration of the contraction to 5 seconds, then 10 seconds. Masturbation, when performed consciously and without haste, can complement these exercises, helping to improve blood circulation in the pelvic region and promoting proper prostate function. During sexual activity, whether alone or with a partner, the pelvic floor muscles naturally contract and relax, providing a type of natural exercise for this area. In addition, the prostate itself contracts during ejaculation, helping to expel seminal fluid. This natural contraction process can help keep the gland functioning properly, just like any other muscle or organ that benefits from regular use. However, it is important to note that if you are experiencing symptoms of prostate problems, such as difficulty urinating, feeling of incomplete bladder emptying, frequent need to urinate during the night, or pain in the pelvic region, it is crucial to consult a doctor before starting any new sexual activity or exercise. In some cases, such as acute prostatitis, inflammation of the prostate, it may be recommended to temporarily avoid ejaculation until the condition improves. Another important aspect to consider is the connection between mind and body when it comes to sexual health. Stress, anxiety, depression, and other emotional problems can significantly affect both sexual desire and physical health, including prostate health. Studies have shown that chronic stress can increase inflammation in the body, which in turn can negatively affect the prostate. Finding healthy ways to manage stress is therefore crucial to maintaining good prostate health. Masturbation, when not compulsive and performed in a context of self-care and self-knowledge, can be one way to reduce stress and promote emotional well-being. The release of endorphins and other neurotransmitters during orgasm can help improve mood, reduce anxiety, and promote better sleep, all of which contribute to overall health, including prostate health. Speaking of sleep, this is another crucial aspect of men's health after age 60 that deserves attention. Sleep quality tends to decline with age, and prostate problems, such as the frequent need to urinate during the night, can further worsen this situation. On the other hand, chronic sleep deprivation can increase inflammation in the body and potentially contribute to prostate problems. Creating a healthy sleep routine, including regular bedtimes and wake-up times, a comfortable and dark sleeping environment, and avoiding stimulants such as caffeine and electronic screens before bedtime, can help improve sleep quality. For some men, masturbation before bedtime can promote relaxation and facilitate sleep. However, if you are experiencing prostate problems that cause frequent urination during the night, it is important to discuss these issues with a doctor to find the best approach for your specific case. Another important aspect related to masturbation and prostate health is the issue of lubrication. With age, the skin tends to become thinner and less elastic, and this also applies to the skin of the penis. Using a suitable lubricant during masturbation can help prevent irritation and micro-injuries, making the experience more comfortable and enjoyable. Choose good quality water-based or silicone-based lubricants, avoiding products with fragrances, dyes, or other additives that may cause irritation. Petroleum-based products, such as petroleum jelly, should be avoided as they can degrade tissue over time and increase the risk of infection. Another important consideration is the duration and intensity of masturbation. With age, the body may take longer to respond to sexual stimuli, and this is completely normal. Forcing an erection or ejaculation through very intense or prolonged stimulation can cause irritation or even injury. It is important to respect your body's natural rhythm and not to pressure yourself. Remember that sexuality in maturity can be a more relaxed experience focused on the process, not just the result. Many older men report that, although it may take longer to achieve arousal and orgasm, the experience can be richer and more satisfying when approached without haste and with full attention to the present moment. Now, let's address a topic that many men are curious about but rarely discuss openly: the possible relationship between ejaculation frequency and prostate size or condition. As we mentioned earlier, prostate growth with age, benign prostatic hyperplasia, is a natural process related mainly to hormonal changes and not to the frequency of sexual activity or masturbation. In fact, some studies suggest that regular ejaculation may be associated with a slightly smaller prostate and fewer urinary symptoms in older men, although this relationship is not yet fully understood and more research is needed. One theory is that regular ejaculation may help eliminate substances that could otherwise stimulate prostate cell growth or cause inflammation. Another possibility is that men who maintain an active sex life generally have healthier lifestyle habits overall, which could explain the correlation. Regardless of the exact mechanism, What we know for sure is that there is no evidence that moderate masturbation causes prostate growth or aggravates existing prostate problems. On the contrary, as we have discussed, there is evidence suggesting possible benefits. Another important topic to consider is the relationship between masturbation and hormone levels in older men. With advancing age, testosterone levels naturally decline, a process sometimes called andropause or male menopause. Some men worry that frequent masturbation may further decrease their testosterone levels. However, research shows that masturbation does not cause a significant decrease in testosterone levels in the long term. In fact, some studies suggest that sexual activity may be associated with slightly higher testosterone levels, although this effect is temporary. Testosterone is important not only for sexual function, but also for maintaining muscle mass, bone density, energy, mood, and cognitive function. Maintaining healthy levels of this hormone is therefore crucial for the overall well-being of older men. In addition to sexual activity, other factors that can help support healthy testosterone levels include maintaining a healthy weight, exercising regularly, especially resistance training, ensuring quality sleep, managing stress, and consuming a balanced diet rich in protein, healthy fats, and vegetables. It is important to note that if you suspect your testosterone levels are low based on symptoms such as persistent fatigue, decreased libido, difficulty gaining or maintaining muscle mass, increased body fat, or mood swings, it is recommended that you consult a doctor. Blood tests can determine your hormone levels, and your doctor can recommend appropriate approaches, which may include lifestyle changes, supplements, or, in some cases, hormone replacement therapy. As we come to the end of our video, we would like to emphasize the importance of a holistic approach to prostate health and sexual health after age 60. Although we have focused on masturbation and its possible effects, it is crucial to remember that no single habit completely determines your health. The combination of several factors, including diet, exercise, stress management, adequate sleep, regular medical checkups, and a positive attitude toward aging and sexuality, is what really makes a difference. Masturbation, when practiced as part of a healthy and balanced sexual expression, can be a positive component of this overall picture. However, each person is unique, with their own needs, preferences, and health conditions. What works for one person may not work for another. It is important to be attentive to your body's signals, respect your natural limits, and seek medical advice when necessary. It is also essential to maintain open and honest communication with intimate partners and healthcare professionals about any concerns related to sexual or prostate health. Many problems can be successfully treated when addressed early, but this is only possible when we are willing to discuss these issues openly. We would like to thank you again for taking the time to watch this video to the end. We hope that the information shared here has been useful and enlightening, helping to demystify some aspects of male sexuality after age 60 and offering practical guidance for a healthy and balanced approach. If you like this content, please leave your like, share it with those who you think could benefit from this information, and don't forget to subscribe to our channel to receive similar content on men's health and well-being on a regular basis. In the comments, we would like to hear your opinion on this topic or suggestions for future videos. What other aspects of men's health after age 60 would you like us to address? Are there any specific questions that remain unanswered? Your participation helps us create increasingly relevant and useful content for our community. Remember, it's never too late to invest in your health and well-being. Small changes in your daily habits can have a significant impact on your quality of life in the years to come. Take care of yourself, value yourself, and allow yourself to live fully, with health and vitality, regardless of age. See you in the next video.